Hello and welcome to the Womxn Show. I'm Lenina Rasool and today we are speaking about elder care in South Africa. Now the UCT Caregiving Program has released 2 reports that speaks to elder care and support in South Africa. After the break, we're going to be speaking to them about the funding of elder care and support programs in South Africa, what older persons need in order to live better lives, and also what elder care looks like in the context of community and family care. But before that, we are going to have a look at a short video about some of the challenges that older persons are experiencing. Let's have a look.
Welcome to Sandton, Johannesburg's opulent financial district, also known as the richest square mile in Africa. It is a stone's throw from the township of Alexandra, equally vibrant but with many people struggling to have a decent life.
This is my house, it's where I'm staying, but now I'm outside the door. I can't get inside anymore. I need somebody to support me to get inside the house. The toilets are very far from me. People, they have to push me at night, go to the toilets. I've got one of my friends, I just phoned him. He stays next door there.
Ben spent 48 years of his life under apartheid, a system of racial segregation that discriminated against Black, colored, and Indian Asian people in South Africa for decades. Apartheid policies denied the majority of today's older South Africans a good standard of education, decent work, and the ability to save for older age.
Kule ndawo engihlala kuyo ndifike ngo-1980 kule ndawo apha ehostel. Khange ndibeke imali ngoba bendisapotha abantwana kungekho umuntu osebenzayo ekhaya, kungekho mali endizibekela yona.
Florence is 79 and is eligible to receive the monthly older persons grant, about $110 from the government. It is for people aged 60 and above. She also receives an additional monthly grant in aid of 500 Rand, about $25, to pay someone to care for her at home. She says the money does not go far enough to enable her to live with dignity.
Andithi ke nandigula ukhona next door wam ngapha. Sesaxelelana uba xa ngabe ndigula ndizawutshaya udonga, noba kusebusuku nditshaya udonga uzawuwazi ukuthi ndiyambiza kukhona into erongo.
This is the Eastern Cape, one of South Africa's most beautiful provinces, but also one of its poorest. Here, there are very few government care and support services available for older people in the community. This is one of the few.
The way older persons are treated by government is not acceptable. We find situations where government would say, I am not going to fund older persons. And we have to take government to court for that. It shouldn't be like that.
At the Dimbaza Society for the Aged, older people take part in social, educational, and other activities.
In this center, there are a number of beneficiaries who want to come and register. But they can't do that because the money they have or the money they get from government is not enough. We do not receive enough money from government. So what's the point of allowing other beneficiaries to come in when in fact you are not going to have food for them? You can't do that.
Akululanga kum njengoko ndihlala nomuntu omkhulu apha endlini. Sihlala sobabini qha, akekho omnye umuntu wesithathu. Lixesha endileqayo lokungena emsebenzini ngo8:30. Akufunekanga ndibe late. Funeka ndikhwele imoto ka6 o'clock. Ngoba ndisuka apha ndibheka phi eMonti. Kuyenzeka ke ndifike ngo9 o'clock apha endlini uyedwa akanamntu apha endlini.
Umka endiphekele beke phaa ukutya kandilambileyo ndiphake andilamba andithini bangaba kutheni akude kube leli xesha engekafiki soze angabikho
Iza nanjengoko ehleli yedwa apha endlini inintsi into enokwenzeka. Izange abantu abazawungena ngokuthi mhlambe bezomlimaza bayamripha bayamenza ngezo zinto ezo zinakho ukwenzeka because akukho umuntu ezibanibona basihlala ezantsi apha elalini. Ndibe kwamna ndifika ndinexhala loba ayiwanda ukhona na apha endlini ayiphathi kakuhle le nto.
Pamela would like someone to support her mother when she is at work, but her wages and her mother's older person's grant are not enough. South Africa is obligated under international human rights law to ensure that older people can live independently and within the community.
Andiqondi into yobana umntu ozawube ejongana naye uyakoneliseka imali engange-500 a month.
The Constitution provides that their dignity must be protected. It says that, government must provide funding to these people.
Lapha ePhalamende kunabogogo abafika bebancinci. Kodwa abazinto ngabogogo abakaze bavele nje bathi sifuna ukwenzela ogogo something lutho.
That was a short video about the challenges that older people are experiencing in South Africa. We are going to take a short break, but we'll be back with more after this. Welcome back. You're still watching The Womxn Show, and today we are speaking about elder care and support. And joining me in studio is Professor Elena Moore from the UCT Family Caregiving Program, and also Elda Sidlabane from Grandmothers Against Poverty and AIDS. Welcome, and thank you for joining us.
Thank you.
Thanks for having us. So, Elena, we are here also, we're speaking about this because of two reports, and I'm just going to name them. One is the Older Persons and Community Care in South Africa, and the other report is Funding Elder Care in South Africa. And before we delve into what those reports say, I just want to ask, what gave rise to this project, and why is it important that we be speaking about elder care more deeply?
Thanks, and thanks for having us on the show. I mean, I think there are many responses to that, right? There is very clinical responses that we could say the older person's population in the country and in the region is rapidly increasing, so we're going to have more older persons in our society today than we've had in the past. But when we think about, our society here in South Africa, but also in the region more broadly, we got to think of, well, who the older persons in this country, how have they been treated in the last, 200, we can go as far as we want to go. Let's say the last 50, 60, 100 years, 200 years, particularly during apartheid. And so if that, if older persons coming into older age today have lived a certain life through being marginalized, oppressed, what does that mean for how they what resources they have today, or what conditions they live in, what access to healthcare or just other forms of care and support do they have, and how is that played out across the country, across the region, and also when that is constrained, and there are many constraints and inequalities, as we know, who makes up the shortfall? Who carries the responsibility to look after older persons? And how is that changing over time? So when we moved into a post-apartheid period, what kinds of decisions were made to transform and change how older persons, specifically Black older persons and women specifically, are now being better supported and cared for, not just by their families, but actually by the state, by NPOs, by other organizations in the community. And so that was the real story behind. We know very little about how the care of older persons actually takes place. We know quite a bit about the health conditions. So there's quite a lot of research and understanding about what health conditions exist, how is that changing. And I think what's happened in the past, given the various pandemics, now I'm not talking about COVID, but AIDS and HIV, grandmothers and older persons were the caretakers, care providers. They were there. But that also overlooked the various needs that they had too, and so we need to start thinking about, yes, older persons are care providers, but they also have care needs. And so not only how do we make sense of that, and what do we not know, and what evidence exists for how care in a family, where there are many care needs, not just for older persons, but also for younger kids or people living with disabilities or whatever. How does that all happen? And who helps, and what is needed? So how do we make sense of it? What are the kind of consequences when we leave families, but not just any families, particular families, people living in poverty, when we leave all responsibility, just women in particular, to look after their families? What's the implication for the older person? But also, what's the implication for the caregiver? What does it mean for their lives and their day-to-day, opportunities, activities, costs, constraints, not just the constraints. There are lots of positive aspects to caring, but there's also lots of challenges. And I think thinking about this holistically is really important, not just given the history, given the change in population, the demographics. So that is a real challenge going into the future, and it's not the distant future, it's the immediate future.
Thank you. I mean, you're raising so many different things. And one of the things I'm thinking about is when we think about care work, we can also think about the fact that care work is often not seen as real work, right? It's not recognized, but actually I don't like to call it a burden, but we do talk about care burdens, right? And you also, when you speak about other pandemics and HIV AIDS, what's so interesting is that, it's directly related to caregiving in terms of our foster care grant. That was a result of so many deaths due to AIDS, and so many grandmothers especially ended up looking after very small children, and that directly affected the foster care grant in court. And so when we talk about the lived reality and we talk about the constraints, Elda, you are a field worker with the seniors program with your organization. And so you are at the forefront of working with older people, with seniors. What does the reality look like? What are some of the constraints that people are struggling with on the ground?
Oh, thank you. So many things the grandmothers are struggling with. First of all, when the children grows up without parents, by the time they're getting maybe about 12, 13, 14 years, they start disrespecting the grandmothers. They can do anything wrong because they know this is the grandmother, not the mother. And then after that, the grandmother start getting sick. Sometimes he had high blood pressure, all kinds of things. But with a gathering, like we got clubs, we decided there must be clubs in the locations where the grandmothers can advise each other and they can speak out about their problems they have. But some of the grandmothers, they're so secretive. They don't reveal all about their grandchildren because they don't like the people must know what her grandchild is doing. Meanwhile, she's struggling at home. They're stealing their money, the grant money, they smoking drugs, they coming home late, they bunking schools. But the grandmothers don't want to speak about that. Some, they speak up about that, but some, they said, no, my grandchild is not like that. But when I'm going to visit the clubs, I just like to speak one of the grandmothers aside. It's where they reveal the truth, that they don't want to speak to other grannies about it, because sometimes the grannies, they talk about your child. I said, no, don't worry about that. If you tell somebody something, if that somebody is talking about what is troubling you, don't worry about it. As long you feel relief, you speak about it to somebody, because you really need help. But if you keep it inside, you'll never get help. So those are the things that are troubling the grandmothers a lot. And also, I think they don't get enough help from the government, because in the locations, the social workers, they don't work as much as we thought they will, because there's still the grandmother, until now, there's the grandchildren, they still didn't have grant, because they don't know where the mother is, they don't know who is the father. So when they're going to Home Affairs, they said, you must go look for the mother. Is the mother dead? They said, no, just go look for the mother. Where are you going to look for the mother? The mother left the child as a baby, a small baby in the house. So some of the grandmothers, they're struggling like that. They really need help for that. But our help becomes very slow. It takes time for them to get help. Also, when they go into the clinics, they take very long. They're going 6 o'clock in the morning. They will come back about 4 o'clock in the afternoon, because there's so long queues. And most of the time, they're just sitting and chatting to each other. They don't care about this hungry old people they're sitting here. That's why when we went to the parliament, we asked if the government can go to the clinics and ask that can be the day for elderly people only, so that they can get help immediately, then they can go home in time. But still, that still didn't happen, and we still didn't get the answer. That means our government is too slow to fix whatever we're crying for. So it's very difficult. And also other grandmothers, they're starving. Because if your child is taking drugs, stealing your money, you got no other income. So you'll wait again for another grant. So those are the things our government have to look for. If we had enough social workers, that should be sorted. Because if the social worker come to my house and I tell her what is my problem, she can fix it. But it doesn't work like that in our country.
Thank you, Elda. And I think you're speaking about so many different things that that grandmothers are going through, and especially in intergenerational households. And that narrative, actually, I think especially we can read about it in the news a lot, when you're speaking about when the young children get older. You're speaking about the young, not even your own grant, but the young children's grants that are not being, we don't know how to get it. And so there's a financial deficit in the household. And then, Elena, to come back to you, now we're looking at support for the caregivers, support for the senior people, for the older people. So even aside from that, there's other types of support that they need, psychosocial support through the groups. Let's look at the one report where we talk about funding elder care in South Africa. And there's a lot in there. I was hoping that you could just summarize it for us. But I know one of the things that was shocking for me was that a massive percentage of that goes towards the grant, the seniors grant. Only 2% towards programs. So maybe we can talk about how funding features into that.
Yeah. I mean, everything Elda says is obviously what you see, all those tensions that exist. They have explanations that lie not just in that one household or the next household. They lie at a societal level. So it's all about you know, we might say that there are not enough social workers in a particular area. Social workers themselves are stretched. You know, there's not enough, yes, and they are covering large areas, and they're covering multiple, you know, cases or issues. So they're not working specifically with older persons. They're working also with young folks. You know, it might be medication adherence. There's many issues that they're covering. So if you talk to social workers, they'll say we're stretched. We're doing the best we can. Yeah. And the same with home-based carers, for example.
And can I just say, we know also there's been lots of reports about a shortage of social workers in South Africa. So we know there isn't enough.
Exactly. And so it's not unique to older persons, but it plays out very much in households where there is a need for referrals. The problem is other folks can't refer. Social workers are the ones who can refer an issue, whether it's elder abuse, whether it's a recommendation to perhaps apply for a place in a residential home, for example. Social workers are the ones who do that work, and so that's why they're so necessary, together with home-based carers. But going back to your question, in order to understand how these shortages kind of take place, one has to think about the entire, how do we support and fund elder care provision? There's different types of care. You mentioned that basically the older person's grant, what I think everyone in the country is very familiar with, takes up 98% of pretty much of the funding that DSD gives in terms of care provision. Now, I don't want to isolate, when I say DSD, I mean the Department of Social Development. We know that other departments, housing, you know, Department of Health, they also cater for older persons. Many departments cater for older persons. But the Department of Social Development have the mandate through the Older Persons Act to be specifically looking after the rights, you know, and responsibilities of older persons. So we focused on their spending. It's categorized in a way that one could actually analyze it too, because it is designated to older persons. And so when we looked at that, we saw roughly 98% of all the money that goes to DSD from Treasury goes to the Older Persons Grant. Now, the Older Persons Grant is essential. We would never critique it. It does phenomenal work in alleviating poverty and improving food security. That doesn't mean it doesn't alleviate food security in current costs of living that are exceptionally high and getting higher and higher all the time. There's lots of things that the government could do there. So whilst we don't want to speak badly of that, you know, we recognize the good that does. The remaining 2%, which roughly is about 1.5 billion, right, is mainly given to subsidize service centres for older persons, where older persons gather, and they could have meals, health clubs, social clubs, any cultural activities, health programs, as I said. So it covers that, and it covers the subsidies, and I say subsidies because it's usually partial funding for homes, care homes. Now, the problem with that is first of all, 2%, 1.5 billion, it's currently reaching roughly 100,000 older persons. Now, so if three...
Just clarify,
in the country. So
right.
If you think about it, there are roughly 5.6 million older persons in the country. 3.8 million of them, so 75%, receive the Older Persons Grant, right? We know there's eligibility requirements for that. And that's that's the group we're most interested in supporting. Now, from that, only 100,000, so out of 3.8 million people, get some type of care provision. That's not about money. So the grant is money that goes into people's hands, if it works, you know? But care provision is support that comes in terms of home-based care, social work. Sometimes also this is partially funded by Department of Health, so we have to be careful there. But it's about the clubs where people have lunches, where people actually can meet, talk, share concerns, but also get food, also maybe get their blood pressure taken, and other health kind of activities. Also learn about various, not just health conditions, other kind of issues going on. So these are essential. Problem is, they only operate in places where there is an organization. So that's, as I said, it's 100,000 people. It's not a lot. We estimated that the care need, so someone who's an older person who has a care need, and that could be a care need with being able to walk, being able to, on their own, without assistance. So someone who needs assistance with either walking, eating, dressing, bathing, the everyday things that we all do, is about 40% of the older person population. So it's about 1.5 million people. So 100,000 older persons are being given some form of care provision, We think it should be up and around 1.4 million people. So the gap is huge.
Wow.
Now, some older persons don't receive any care provision because they don't live in an area that has an organisation. Gapa, you know, the grandmothers against poverty and AIDS, like, they're fantastic. They do work, and there's loads of NPOs that do phenomenal work. They are stretched, and they are doing the work of supporting older persons, but they're only being partially funded, and they're not everywhere. And that's one of the real concerns. Residential homes are expensive, and they're also not everywhere. They're expensive to run. They are very much for the very, very frail. And so there's a huge group, and I won't even say in the middle, but that group is like pretty much that are not being supported in terms of care provision. When I mean care provision, is practical care, care support, not just money. Money can go so far.
I mean, those numbers are insane. And I'm also just thinking, if we think about this 2% for programs, that residential care is included in that, you could be forgiven for thinking there's almost nothing left for actual programs, for anything outside of residential care. But ladies, we need to take a short break. Elda, I believe that you are leaving us now for this segment, but I want to thank you for coming on and sharing your thoughts with us.
Thank you so much to have me here. I just hope all the messages we're sending today, they will make a change in our townships.
Thank you. I
Thank
hope
you.
so too.
Yes.
We
thank
have
you.
to take a short break, but we'll be back with more after this. Welcome back. You're still watching The Womxn Show, and we are speaking about elder care in South Africa and what type of support and funding older persons need in order to improve their quality of life or just reach a baseline for quality of care in their life. And still with us is Professor Elena Moore from the UCT Family Caregiving Program, and joining us now is Buhle Maseko-MacArthur, who is an occupational therapist, also with Grandmothers Against Poverty and AIDS. So welcome.
Thank you.
And so just to carry on from our previous conversation, Buhle, I was hoping that you could tell us, we spoke a lot about some of the challenges that older women specifically, but older persons in general are experiencing. And you're an occupational therapist. And first I want to ask, so what do you do as an occupational therapist? And I'm assuming, I read a little bit, that's also going out to older persons' homes. And so just so that we can get an idea of what kind of care and support older people need, you know, working on the ground, working directly with them.
That's a great question. So as an occupational therapist at Grandmothers Against Poverty and AIDS particularly, we're trying to look at more systems and holistic-based approaches to caring for older people. And so there's work that OTs do in health facilities, in residential care places, but what we're trying to do is give more support, really, to the ideas that already exist. The grandmothers and grandfathers in the communities already have models for what makes sense for them, how they need to be cared for, how they can thrive in their later years. So as an organization, our work is really to make that happen. So my work really is about supporting the network of self-help groups in Khayelitsha. Sometimes that looks like having workshops that equip different leaders, senior leaders in these clubs, to be more responsive to the issues that arise. So a lot of that is health, mental health, being able to respond to the challenges of living in the township, really. It is, it takes a huge toll. So there is a lot of workshops and training around how do we support each other through living here. But there's also chronic illnesses of aging, high blood pressure, diabetes. There's a long list. But it is also about making sure that they're always knowledgeable about how to lead healthy lifestyles that in contextually relevant ways. There's a lot of advice that's out there, but it's not always relevant to someone who's working on a 2,080 Rand pension. So yeah, it is a lot about really increasing their capacity to care for each other. But the focus really is on the care that they're providing each other. And we are just glad to be able to partner with them in that.
Thank you so much. And I think also, we can go on, speak about medication, because when we're speaking about health, you're also speaking about money. And often that is sort of removed from the conversation when we're talking about the grants often just go to food, school fees, like yearly transport, like really basic things. Elena, I want to ask you, you also did some research around how elder care is experienced within the family, with not an emphasis, but a viewpoint of what does that look like? Who are the caregivers? From a gendered perspective, who does this care work, which is often also then other women. And what are some of the challenges that arise for a multi-generational home like that? And so, again, I wanted to say earlier, we don't like to use the word care burden, right? We don't want to say, and I think there's a lot of perception and stigma around older people not wanting to be a burden. And so often they don't speak about the challenges that they are experiencing. So we're not speaking about it from a burden perspective, but just saying, what are some of the challenges that you've found in multi-generational homes where care is given and needed for a senior person?
Yeah, I mean, there's a lot there. So, I mean, firstly, I think we got to understand that a vast majority of households are multi-generational. So that is by all means the norm. And that's what we need to be thinking about and talking about. And in our policies and in our programs, that is what is standard. And in that regard, you've got to locate then, if there is a specific care need, because obviously there's different types of care needs. There could be emotional, there could be financial, there could be practical, health, etc. So if there is a particular care need for an older person, that is not in isolation, like I said earlier, I think, to the other care needs and other ongoings of everyone else in that family. So whether that's, having young children around and their need to get to school, go to school, be fed, be dressed, etc. Or if there's someone of a young adult living in the household who can't find employment, what are their care needs, men or women, and the list is long, needless to say. So it's also not only in that household. People are obviously, working and connected to and love other family members who are in other parts of the country, other parts of the city. And so help, and practical support and care needs flow in multiple directions all the time. But I think what's important to realize as well is that when we think about care, what are the aspects? Yes, there is the practical caregiving, and we know that is gendered. We know that women are doing that. Some women who can pay for it, most women can't pay for it, they do it themselves. Which women are doing it? Is it older persons? So older persons are the caregivers themselves, we know, a lot of the time, even when they have a care need themselves. They might be caring for a spouse, they might be caring obviously for grandchildren if they're around. So there's, but the care is also financial, like you mentioned. It's practical, it's emotional, it's social. So if there's a neighbour coming in to have a chat for half an hour a day, that's fantastic. That's a care need, companionship. But also who is then, not to go back to the finances all the time, but who is financing the household? Who's paying for the food? Who's paying for the transport? Who's paying for the basic needs? And we're not talking about extras. We're not talking about extra medication. We know that the clinic provides medication for the most part and run a fairly efficient service in that regard. But who pays for the extra pain tablets when there is a lot of pain, when you have an ulcer or when you have, whatever it might be, back pain, arthritis? You get a certain amount, but there's loads of extras. So that, we spoke earlier about the older person's grant, that 2,080, covers the whole household in many respects, often not, and there may be other child support grants or other income coming in. But to what extent is all that money shared, pooled, managed, negotiated? And that's where we see tensions come in, generally speaking, not just on the finances, but also then the doing. So who's looking after, who's going to the clinic with an older person? Who's bringing a child to school, and why are there certain people, and there's many reasons why it might be one person over the other person. And I think that we need a bit more understanding of. Yes, it is gendered, and there is, historical reasons why that might be so. There's socialization reasons why that might be so. There's also maybe norms in the household itself about who's meant to do that work, but also from an older person, you know, let's say an older woman's perspective, who does she want helping her to do X, Y, or Z, you know? And so, so we do have to unpack what care is, like who is driving someone to, like, you know, who's driving someone to a clinic or to a hospital. That is care, that is support, you know, and then who's maybe paying for the petrol. That might be someone else in the household. And so all of these, it's like a jigsaw, you know, it is like a puzzle. There's different parts to it, but tensions do creep in when there are constrained resources. So Elda earlier on spoke about, you know, younger people might be abusing money but also you got to think about, well, what are their opportunities to have jobs, to have their own income, to have an income, and an income that can actually survive, you know, make people sustain their livelihood. So whilst we can often blame or assign blame to individuals at a particular, you know, we also have to see it in broader context.
Of course.
So yeah.
And we're thinking about, like, and this is the thing I always bring up. Actually, the conversations I've been having lately with people is like, there are not enough jobs, and they are getting less and less as we're looking at technology evolving. And so, what are we going to do? Like, not even for specific whatever. What are we going to do? There are people graduating now. There are no jobs for them. And so, but I wanted to come back. It's interesting what you're saying about the care, the practical side of care work. There is and especially after COVID, there were so many articles just talking about care work in terms of who does childcare. But the things are, and my mom lives with me, so we have to coordinate also who's taking her to church, and the hairdresser, and the doctor, and the clinic, and like those things. And there's a different feeling to it. So I consider the feeling of my child is dependent on me, so no matter how angry I am that I have to get up and drop her. She had a concert recently, so she's leaving school early, and then I have to get her ready, and then I have to take her back, and then I have to fetch her in the evening for 4 nights a week. But I have to do that, and there's no friction. And yet when we're thinking about someone who's more senior, we're thinking about another adult also, and how does that show up, right? And so all of these tensions show up in the household. But you know, we don't have a lot of time left. I just wanted to come and maybe both of you can answer this question, because ultimately when we opened, Elena, you were speaking about, so whose responsibility? You know, what is the government's responsibility? What is the family's responsibility? And when I was Googling this topic, I came up with the phrase, someone had written a book, I don't think it's local, but they were just saying a lot of policy around elder care is family-centric, with the perception that the family should take on the bulk of responsibility. Now, for all the reasons that we mentioned here today, including, as you said, the pandemics and the AIDS pandemic, where there isn't a family to do the elder care, the elder person is the caregiver. How do we think about, and I think I said when I sent an email to you, I said, you know, most people haven't read the Older Persons Act. We don't know what's in there. We do take on that responsibility. Our perception ourselves is family-centric. This is something that we are supposed to do. What is the state's responsibility, and how can we think about that?
Want to go first?
Yeah, I think it's quite a big question. I think that because we kind of all exist in families, it is the what's the word? The inclination is to just say it must be the family's responsibility. But I think if we think of aging and consider that we are all walking towards aging, and acknowledge that this is something that we will all face, it's important for all of us to think about it. And so I think that as the state takes different things as priorities, like schooling is a big responsibility, I think that aging definitely has to be a huge responsibility as well. But yeah, I think in practice, that's hard to know. I think it's good for people to connect with the people that are already doing the work. So there are people like us, but there are also people like neighborhood old age homes. There are people like Age in Action that have really been looking at what what aging looks like, what it looks like to really promote active aging, what it looks like to support people who have diminishing function. Yeah, I just think it's important to really partner with the people that are doing the work, and also just to ask older people. They are very clear on what they need, and I'm sure you heard Elda's conviction. They're living these lives, and they know what they need to live better lives. So yeah, I think the big thing is communication, and taking it from there. I definitely think that yeah, the policies are in our favor, but unfortunately, when it comes to implementation, a lot of things go wrong.
Yeah, yeah.
I mean, I reiterate and agree. It's, you know, it's not just the state and the family. There are NPOs, organisations, civil society doing phenomenal work. Could be better resourced. You know, I think we all agree that they could be support. I don't think any of us expect the state to carry out the function of day-to-day care. I don't think older persons necessarily want that. You know, I don't think they can. I don't think they have the finances to do so. I don't think families want to get rid of that responsibility. It's about being in a better place, better supported to do that work with the help of NPOs, you know, with different organizations who carry maybe different functions depending on, with the clinics, you know, with the occupational therapists, with social workers, all the different bodies that exist in this wider kind of landscape of care, and that they are a better resource, because we've got to remember there is a legacy of expecting families to do everything, you know. Not just the apartheid legacy, earlier colonial legacies that created that expectation, and purposely. And so whilst there is a kind of a norm that, yes, my daughter will look after me or whatever, that was also engineered at a certain moment in time. And it was made, you know, to carry out for, let's say, black families, but not specifically. The state did support white families earlier on in different ways. So those hierarchies and those differences were created. But there are, you know, also cultural norms about certain people should be looking after an older person. You know, it's my duty. And that's completely, I think that's across all families. People feel an innate duty to look after older persons, but that has to be supported with all the various, like churches, for example. We haven't mentioned, I say churches, various religious organizations do a lot of good work. You know, they're also in the mix of the state and the NPOs, you know, and others who are doing really, really good work that are not only always just geared towards older persons, but where older persons are also supported.
And I think especially as a place of like socially, church is a huge like social, it has a huge social element to it, and a huge possibly also psychosocial element to it. And so when we think about the state though, just when we think about the state's responsibility to older persons, and I just want to bring in again that statistics that, you know, we have such a huge older population and 100,000 people doing programs. I think the nature of how we exist has changed. So possibly also once upon a time when women had less rights and were not working and were home all day, it was easier to do elder care just because we were there. But now it's not. I think in one piece of the reports, and I'm not sure if it was the UCT, there was talk about a woman who's looking after a mother but works for 12 hours a day, and so has to leave her mom at home, has to pre-make her food, worried that the mother won't even eat because she doesn't have the capacity, her memory is not so great anymore. And so when we want to contextualize what is the state's responsibility to programs, can we think about it the same way as the state's responsibility to children's education? Is it as important? How do we think about this in the context of us feeling responsible for everything?
I mean, so if you take that example, it's a good example, right? You've got to think in that example, you have the care needs of the older person, who might be at the center of everyone's idea, like thoughts and concerns. And that may go into areas of elder, not abuse necessarily, let's say call it neglect. But then you've also got the woman who's working. Like, what does her life look like? And so she's running from A to B to C, you know, trying to do everything. And so her opportunities and her chances to actually manage, cope, live, breathe, literally, are diminished. So the chances that someone who has such high levels of responsibilities will they can't do that forever. It's just not sustainable for one person to carry that amount of responsibility. And then that's what's happening really. What we see a lot of in families is that there is that person, you know, trying to do everything and trying to finance it all, trying to do it all, and really stretched. So what impact has that on what we could call the next generation of older persons, but just even the current generation of mainly women and mainly Black women? You know, so that's something that really needs, because if this then will lead to, once we have policies and thoughts around transformation, the next generation are going to be constrained in how they can manage, because they're doing everything.
And let's just also say, I mean, we're going to be the next generation of older people. And so some of the things, you know, because one of the, we're sort of out of time, but one of the things I was going to say is like, how can we take an active stance in driving this? And if there's any incentive, is that if we are able to change policy and budgets and fix things right now, that is going to set us up. And we are out of time. Thank you so much, ladies, for coming onto the show. Any last words?
Thank you so much for having us, and thank you for putting older people's needs in the forefront.
Yeah, exactly. It's conversations like this that are really important. Thank you so much for having us.
And thank you for being here and sharing with us. We are going to take a short break, but we'll be back with more after this. Welcome back. You're still watching The Womxn Show, and we've been having a great conversation about elder care in South Africa, what it looks like, how it's funded, and what more needs to be done.
Now, before we go, we're going to play a short insert showing some of the important work by Grandmothers Against Poverty and AIDS. Let's have a look.
We support grandmothers who have been affected, whose lives have been affected by HIV and AIDS. We were started in 2002, and at that stage, we had only 13 grandmothers and an occupational therapist. From that 13 grandmothers, today we have close to 600 grandmothers, or just over 600 grandmothers, and grandfathers, mind you.
So Gapa is a network of senior self-help groups across Khayelitsha. They're seniors in Khayelitsha who want to age actively, who care about their communities, and who want to be meeting together and doing life together. So at its core, that's what Gapa is. Seniors who care about their health and their well-being and their families, and they come together to really support each other in that work. So many seniors have been able to learn different skills from the space. So skills like sewing, crafting, and beading, and even knowing how to tend to a garden.
Uba lilunga lapha kwaGapa kubaluleke kakhulu empilweni yakhe. Iyandinceda into yokuza apha, iyandinceda nakwi-exercise, iyandinceda nasekutyeni, iyandinceda nasempilweni. Siyalungiselelwa yonke into, neengxaki esinazo ezindlini zethu siyalungiselela. Silungiselelwe kubakho noogqirha abafikayo apha, namanesi, nabantu abakhulu bakwaSASSA, sixelelwe uba masiyiphathe njani imali yethu nendlela yohlukumezo, siyancedakala. Nezifo ezinjenge-dementia nezinye izifo nengqondo ehlukumezekileyo, siyancedakala apha, sifundiswe. Kubekho abantu abafikayo abangoogqirha basixelele, basifundise, basiphilise. Siyakhutshwa nokhutshwa apha, sihambe siyadlala nodlala, sikhaba neebhola, siyabaleka nobaleka, siyatya nokutya apha. Noluleko lomphefumlo ke siyalenziwa apha. Balekile ke, ndiyabulela kakhulu uba lapha, enkosi.
An outworking of the care provided to the grannies is the aftercare. Initially, when they would be meeting together, their children would be vulnerable to violence. So they decided that they wanted to create a safe space for kids when they come out of school, and it caters to kids between the ages of 5 to 6, all the way up to 13, so the primary school years.
Gapa is everything the community needs, because whoever needs some help, they come to Gapa. And when they go home with smile.
Because we're strong.
Together, we're stronger.
Together we are stronger.
That was a short video about wonderful work by the organization Grandmothers Against Poverty and AIDS. And that brings us to the end of the show. Thank you for joining us. I'm Lenina Rasool. Goodbye.